fortunate enough to have her come today. She brought her registered nurse, Anne Marie Roberta. They're going to talk to us about hospice. We had a board member pass away, probably because of poor hospice. And it's always been one of my pet peeves, how these people come in and put you in hospice and no physician ever sees you. They send over morphine and lorazepam, and it's just the end of the road. I don't know. I hope you won't tell us, but is this the,
Yeah, you need to fill it out.
well, you take over.
Okay, how do you work this thing out?
What do you want to do?
Well, how do you switch?
Quick, remember that commercial?
I don't want it to click out. There you go. Okay.
All right, hold it over here.
No, but the click movie, you know, it's switched out. Never mind. Okay, so back to the.
Going over here.
See what I'm working with? Quiet. Okay. Did everybody read about the elephant? Hospice is like the elephant in the room. That's what that was supposed to be about. You know, and we're here to dispel your misperceptions and educate you on the elephant in the room. Okay? Magic. Okay. So, did everybody fill out their hospice quiz?
Oh, yes.
Okay, there's a drawing for a $10 gift certificate for Panera Bread. So fill it out, give me your name, just your name unless you want to talk to me later, okay? So, and if you could just not throw them away, I wanted to collect them to see what y'all thought about hospice before the presentation, okay? So, I know y'all are really wondering the answers to the question, right? Okay, so what's the answer here? True or false? Hospice is a government agency that provides end-of-life care.
False.
False. Smart group. I tried to add some pizzazz to the PowerPoint. Can you
So
see?
you and them is like to
Yes.
Yeah? But we have this, so you know. Okay, so a pre-admission visit can be provided by a hospice staff at no. Was that for the light or for me? You have to do
be like.
Okay. You have to do a little magic thing for the light. Okay, so what's the answer here? Can you have a pre-admission visit by a hospice staff at no charge to the patient to explain hospice services?
True.
Okay. Hospice is covered under Medicare, Medicaid, and most insurances.
False.
True.
I thought it was.
Okay, it's true.
And
And we haven't even got to the hard questions yet.
our hospice won't charge you for anything ever. And hospice should
Stand up,
never
Emery.
charge you for anything ever. Ever. Hospice should never charge you for anything ever. If your insurance doesn't cover it, you still should not get charged for it, but you still get the benefit. So if you come to me and you have a Blue Cross Blue Shield policy that says they only cover 80% hospice services, you still receive 100% hospice services. We get paid 80%.
Okay, so why is this? This is why we're here. Because there's 25 hospices in the Richmond area. Okay, you need to know what your patient's rights are. Okay, you need, if you're informed, then no one's going to make you pay that 20% that the hospice company isn't getting from your insurance. Okay, and if they still do, then say, you know what? Let's switch to another hospice company. That's your patient's right. Okay, so. Do you have to be homebound to receive hospice services? Okay, the patient is responsible for all the medications, personal care supplies, incontinence supplies, DME supplies. Is that true or false?
False.
Got a great crowd here.
Actually, hospice pays for all of your medications related to your diagnosis. So if you have a patient that comes on service for CHF, cardiac disease, we would cover all of his cardiac meds within reason. There are some newer drugs that we don't cover yet.
Scratch that all.
Yeah, only related to your diagnosis of hospice do we cover those meds, and then any comfort medication. So Tylenol, anything for Ultram, whatever you take for pain. Also, we do cover oxygen, nebulizers, we cover beds, bedside tables, walkers, wheelchairs, any kind of durable medical equipment, no cost to you.
So that's, I guess that's false. Okay, a patient can no longer use their family doctor once in hospice.
Yes, yes. Skip 6.
6, hospice can be provided in the home, inpatient, nursing home, and assisted living.
True.
True. I just wanted to make sure everybody was on board, paying attention.
Do that.
Okay, so that's true. Patient can no longer use their family doctor once in the hospital or hospice.
No.
False. Some hospices prefer you to use their doctor.
If you were to come on service for CHF, I don't know why I keep picking CHF, or COPD, say CHF, if you come on service CHF, you can no longer see in the office your cardiac physician, because we are responsible for all of your problems related to that diagnosis. For instance, you come to us on COPD, you cannot go see your COPD physician. We have physicians that do come to you. Where's that man who said that we don't? We do come to you, and the nurses will also contact that lung doctor every time she goes to see you. She will call your physician and ask him or suggest to him any changes in medications, oxygen, nebulizer treatments, anything. So you don't lose your relationship with him. Medicare does not allow 2 separate billings to go along. Once you are considered a hospice patient, hospice picks up everything for that diagnosis, so you cannot go see your physician. He can't bill Medicare, if it's Medicare, for that diagnosis. Does that make sense?
Okay.
That's why I'm here.
Oh, cute. Okay, so a DNR is required to make a hospice referral, and someone asked me what a DNR is. It's a do not resuscitate. Okay, so.
You do not
that's
need
false.
a do not resuscitate order to come on to hospice. We do not require it to happen, especially if you're in your home. If you're in your home and you just can't find yourself a sign for your mother or yourself or your loved one, that's fine. We can talk about it. There's other options for you. Okay, so that is a personal choice, and we'll come together and make a decision. But it's not a definite need.
Okay. 9, the hospice physician takes over the care of all hospice patients. True or false?
Again, false. If you come on for us with COPD, your lung doctor would still be in charge of all of your care. We would just be providing it through his wishes over the phone in your home.
Ah.
Unless you do not have a private care physician, then we could provide a physician for you. But if you want to continue a relationship with your physician, he would continue to be in charge of your care.
We learning anything yet?
Yes.
Okay, once a person is in hospice, they can no longer go to the hospital. True or false?
False.
False. Why is it false?
You cannot go to the hospital for the disease that you are on hospice for without letting us know.
Without letting you know.
If you let me know, then it depends on what you're going for. If you fall and break your hip and you're on services for congestive heart failure, that's fine, you can go. If you have exacerbation of COPD and you're on service for COPD, our nurses are trained to do anything that that hospital would do, including IV Lasix, Bumex, any kind of nebulizers, or anything that is needed in your home.
And to respond quickly.
Yes, we have everything ready to go and set up for exacerbations in the home.
Okay, but now this is a question not on the sheet. Once you come to hospice service, are you in hospice prison? Can never get out of hospice? True or false?
False.
False.
Correct.
So if you are on our services, on hospice services for CHF, and you don't care, I want to go to the hospital. Too bad, so sad, right? No. All you do is call the nurse.
And when you call us, what you're telling us to do is to release the Medicare option so that you can go to the hospital and then they can bill hospice. They can bill Medicare. So that's fine. What you do need to understand is Medicare provides a window that we can provide service, 90 days. And then the second 90 days, the nurse has to say why you are restartable for hospice every 90 days. When you get to that second 90 days, you start entering what we call your 60-day. The physician must come to your house to look at you and literally say, yes, this patient is hospice appropriate. When you're in your 90 days, your first 90 days, if you go to the hospital and revoke hospice and then the next week say, I want to come back, you are now entering your second 90 days, even though you may have only been with us for 10 days. You automatically drop the rest of those days. Does that make sense?
Yeah.
Okay. You have,
What was the timing? 180 days?
when you first come onto hospice, Medicare says this patient is now certified for 90 days. 90 days, I am allowed to come out, our nurses come out, and we can treat you for this diagnosis, and we bill Medicare for 90 days. At the end of that 90 days, the nurse has to do a whole nother evaluation, that's a word? You understand that. A whole nother evaluation to say why you are still eligible for hospice. At the end of that second 90 days, you then go into a 60-day benefit period, and then it continues for 60 days. Every 60 days, the nurse must reevaluate your needs for hospice. Some patients do come off hospice because they just don't decline. They hold steady.
That's a good thing.
It is a good thing. And what we would do at that point, if you were no longer eligible for hospice, you would know way ahead of time. We would connect you with home care. We would discuss other options. You just may not need us right away. We may have signed you up maybe a little too early.
Or you got better. I mean, patients do get better, and then they stay
Mostly
stabilized.
stabilized. We can keep you pretty stable. Hospice is a good way to help keep you stable because you have nurses coming out all the time looking at you, monitoring your medications, monitoring your eating habits, your sleeping habits. So you may get better, for lack of a better word. You're stabilized.
Okay, don't get too ahead of my PowerPoint. Go sit down. Okay. Does that answer everybody's questions?
Sort of. I think they're still a little confused. It'll get clearer. Yeah.
Okay, 12. Hospice takes care of the patient's symptom management. For example, your pain, wounds, infections, like a UTI.
What?
Okay, back. A hospice referral is made up of when a hospice referral is made when a patient has less than 2 weeks to live. True or false? False. Okay. Hospice takes care of a patient's symptom management. For example, pain, we're the experts at pain. Wounds, infections like UTIs, nausea, agitation, falls, and constipation. We're another expert at that, not me. True or false? Yes. Okay, patients on hospice do not receive nutrition. True or false? And morphine is the drug of choice for all hospice patients. False. We use a lot of other medicines for pain. Okay? So how many got 100 on this? Missed two? False. False.
Patients should always go.
How many got 100?
Lucy, you forgot to put 15.